Hi, I'm Dr. Carolyn Meister,
And I'm Ashley Robato.
and we're going to talk to you about expansion therapy more from the patient standpoint and what to expect from a discovery call or just a consideration of what expansion therapy is. So, we're talking about a breath-centered and core-centered approach. And the importance of it is listening to your body through a movement analysis and a breath analysis. So, we're going to talk a little bit more about the breath analysis right now, and we're really talking about what the rib cage is doing in relation to your diaphragm and your core. And what we see typically, Ashley can kind of talk about.
Yeah, so a lot of times what we'll see typically with people is kind of this pattern of belly breathing. And when they're taking a deep inhale, the abdomen is really expanding. And what happens there a lot of times is this both energetically and physically, your breath and everything is spilling out through the front. And what happens there a lot of times is restrictions or tightness shows up in the back body, and the breath isn't that really traveling there. It's not traveling to the back body. It's not traveling to the side body. And we're not getting this like nice 360 diaphragmatic breath and expansion, but we're kind of just like spilling the breath and energy out in the front. And what can happen as a result is like disconnection, like from our deep core and kind of disassociation, sometimes even from these parts of our bodies. Carolyn, do you want to elaborate a little bit more or add
You
anything
said
to
it
that?
very well. Yeah. So, yeah, exactly that. You're spilling your energy forward when there is belly breathing or even postpartum after having children. Or I see that even in men sometimes. But what we're doing is when that part of you opens in the front, that back has to come forward to shift your weight, right? And so then you're relying a lot on this pressure system back here and not relying on the inner core, the deep core work in the front. And so that tends to have a lot of issues with pain from anywhere from the hips, the shoulders. The fascia is this huge system all over your body, and it's like a pulley system that when you pull on one part, at the head, it can affect the feet even. So understanding that and understanding that the core of everything is the breath, the rib cage, and the abdomen, just like our Gary here. We always got to pull Gary in, right? The core canister. This is what controls the shoulders, the elbows, wrists, the hands, the knees, the feet, the hips, obviously, the ankles, and everything that's moving rotationally through this space is what really helps control the rest of the body.
Yeah.
So we basically what a discovery visit looks like is that for an hour, we have you come in and we take a movement analysis and a breath analysis of what you're doing because we want to see how you're moving. And generally, we see a lot of faults towards lordosis in the lumbar spine. And then a lot of like external rotation of the hips, a lot of people spilling because of that belly breath. Then we instruct you from there on your breathing and kind of what the fascia looks like. And then we are going to be able to give you a few, and I mean usually one cue to start with really understanding how to unlock your breath or unlock your core from like a fascial standpoint and a movement standpoint that's specific to your body.
Yeah, I feel like we've also been showing people, and this might not necessarily be like a discovery visit thing, but like a follow-up is, just how to like connect and activate in new ways and kind of access that internal rotation again, access that adduction, come out of that pattern of excessive lordosis and find how to move your spine posteriorly again, both with activation of muscles and with the breath as well. And just realizing for people like how much can shift when they start to move their body in all the ways that are really possible and they realize like, oh, I don't have to be locked into this position, and kind of these training these new neurological patterns for them.
Yeah, absolutely. So please, like, I think this is a fun educational piece, and I think we're going to keep doing something like this where we get people to truly, maybe we'll pick something and we'll get people to understand a little bit more about their body and about the fascia and how much your breath changes the connection between your hip and your shoulder and all of these different things. So, thank you so much for joining us and learning a little bit more about expansion therapy.
Yeah, thanks.